On behalf of the Medical Council of Canada, welcome. The Qualifying Examination Part 2 is an important examination, and we want you to have a clear understanding of the procedures that you must follow on examination day. Over the next few minutes, we will walk you through the examination process. After this presentation, there will be an opportunity to ask questions. Examination materials are provided by the MCC. However, each candidate is responsible for bringing a reflex hammer and a stethoscope. You are also required to wear a white lab coat and to submit the entrance card that was sent to you by the MCC. All equipment must be carried in your lab coat pockets during the exam, as no bags are allowed. For security reasons, you are not permitted to bring your pen light, cell phone, pager, PDA, pens, pencils, or paper. If you do have these items with you on exam day, they will be locked in a secure area for the duration of the exam along with your coat and bags. Please note that having any of these items with you during the examination constitutes a security breach and may invalidate your results. You will be allowed to keep your passport and wallet with you, but they will be checked by staff to ensure they don't contain any excess paper. At registration, you received an ID badge and a candidate notebook. Please do not open the notebook until the examination begins. This booklet is for note-taking during the examination only and should not be unsealed until you are at your first station. Inside the notebook, you will find a sheet of personalized barcode labels. We'll explain what to do with the labels shortly. Be careful not to rip out any pages or parts of pages. Your notebook must be returned intact at the end of the examination. Remember that the purpose of the qualifying examination is to make a fair and accurate assessment of your clinical skills. Try to relax and stay focused on the examination itself. Staff will guide you from one station to the other. They will be present throughout the examination to answer your questions. Should you forget something in one of the exam rooms, please inform a staff member who will retrieve it for you. The Qualifying Examination Part 2 consists of two series of stations. The first is a series of couplet stations, each consisting of a 5-minute patient encounter, followed by a related 5-minute written station. The second is a series of 10-minute stations. Everyone completes both series of stations. Half of you will begin with the 10-minute stations and half with the couplets. In the stations, you may be required to obtain a history, conduct a physical examination, or to do both. You may also be asked to respond to various patient concerns or to manage an acute problem. You will get a short break between the two series of stations, with enough time to go to the bathroom. If you feel an urgent need at any other time, please advise staff. Timing is very important. Please listen for the buzzers that signal the beginning and the end of the stations, and for the warning buzzer that tells you that your time is almost over. Please note that every station has a warning buzzer. You will have plenty of time to get to each station. You don't have to run. The station number written on your badge indicates your start station. Outside each station is posted a brief description of the patient presentation and of the task you are expected to perform. Read everything carefully and pay attention to the statement explaining your task. A copy of these instructions will be available inside the room if you want to read them again. Here is an example of what the candidate's instructions will look like. There is a brief description of the problem. Joseph Trans, 40 years old, has been brought to your office with a 2-hour history of abdominal pain, and a statement describing your task. Conduct a focused and relevant physical examination. You are not required to obtain a history in this station. If you were, it would be stated in the instructions. Since this is a couplet station, the instructions remind you that you will have to answer written questions about this patient at the next station. When entering the room, please hand 2 barcode labels to the examiner for the identification of your exam sheets. You have a few extra labels in your booklet, so don't worry if you lose 1 or 2. The examiner is there to observe and assess your performance according to preset score sheets. Focus on the task and on the patient, not on the examiner. The examiner assesses you according to scoring instruments that vary in length, and some items are scored after you leave. Please note that the amount of writing the examiner does is not an indication of how you are being scored. A second observer may be present. He or she is there to observe medical counsel protocols and for quality assurance. The standardized patient, or SP, has been trained to simulate a patient's signs and symptoms in a reliable and consistent manner. In some cases, you may assess an SP with stable findings. You should treat SPs as real patients and, of course, as real people. Keep in mind that part of what's being assessed by the examiner is how you interact with the patient.
This pain here on my right side.
And how long has that pain been there?
I'd say since maybe last night.
Dr. Michaud, may I suggest that you reread the instructions, please?
The examiner may intervene and ask you to reread your instructions if he or she feels you are heading down the wrong path. For example, if you are taking a history when you are expected to perform a physical examination. Out of respect for the SPs and because time is limited, you will not perform genital or rectal examinations. If you decide that such examinations are necessary to the assessment of the patient, all you need to do is clearly inform the examiner. This will be enough to receive credit. The examiner will provide the findings if any are available for this patient. Otherwise, the examiner will remain a neutral observer and you may carry on with your examination. During physical examination stations, tell the examiner what you are doing and describe your findings, including normal findings. This will assist him or her in accurately assessing your skills. However, merely telling the examiner what you would do is not sufficient to get credit. You must demonstrate your skills by actually performing the physical examination, which means carrying out the maneuvers that are required for assessing the patient. Be aware that part of your score is determined by the quality of your interaction with the patient. Your relationship to the patient matters and includes factors like respect for the patient as well as your organizational and technical skills. Also note that hand sanitizer will be available in every physical examination station. Please use it. Remember, always wait for the start buzzer before beginning a station, even for the written part of the examination. Do not start writing on the answer sheet until the start buzzer has sounded. The written questions relate directly to the patient you have just seen. General answers related to the presenting problem may be correct, but if they are not true for this patient, you will not receive credit. Read the questions attentively, be specific, and word your responses carefully. Refer to the question. In most cases, short phrases or 1- or 2-word responses are enough. Don't write an essay. Illegible answers will not be scored. If the questions require that you select your answers from a list by filling in bubbles, do so carefully. Be sure to fill in the bubbles completely in pencil, but not so hard that you cannot change your answer. If you need to change your answer, erase the bubble for the answer you don't like and fill in the bubble for the correct answer. Use the pencil given to you at registration. Not all pencils leave marks that are read easily by the scanner, and some do not erase properly. Please note that you score 0 if you give more answers than specified in the question. If you are giving written answers, read the question carefully. If the number of answers required is specified, for instance, list 3 investigations, record only 1 investigation for each line. If there are 2 answers on the same line, only the first one will be scored. On the inside cover of your booklet, you will find a guideline for ordering tests when answering written questions. This guideline lists commonly ordered groups of investigations and indicates what will be considered as one answer. For example, CBC is considered one answer that includes 6 items. When providing written answers, ordering one group like CBC is considered to be one answer. You do not have to specify the tests within the group. In some of the stations, the examiner will ask you 1 or 2 oral questions, which will limit your time with the patient to 9 or 4.5 minutes, depending on the type of station. The posted candidate's instructions will indicate if there are oral questions. There should be no surprises. The examiner will wait until after the warning buzzer to ask you the preset oral questions. During the examination, you will have 1 or more rest stations. During these stations, please sit in the designated area and wait until your next station. There will be no patient interaction or written questions to answer during these stations. You may write in your candidate notebook if you wish. We ask that you be respectful of other candidates by remaining quiet. When the second buzzer sounds on your final station, the examination is almost over. All that's left to do is hand in to the registration desk your candidate notebook, ID badge, and any leftover barcode labels. Then you can sign out. This is important. Do not leave without signing out. For security reasons, your notebook must be returned intact. The notebook will not be marked. Its contents have nothing to do with your score, but failure to comply with sign-out procedures may invalidate your entire examination, so be sure to complete all the sign-out tasks. For security reasons, you may be sequestered before or after the examination, depending on the time zone. During sequestering, you will not be permitted to exit the designated area, nor will you have access to your personal belongings. Any breach or lack of cooperation on your part could invalidate your examination results and prevent your access to future examinations. Let's quickly review some important points. 1. Read the candidate's instructions carefully. 2. Complete the task that is specified in these instructions. 3. Demonstrate your clinical skills. 4. Remember, you only receive credit for tasks completed satisfactorily. 5. Treat the SPs as you would real patients. 6. If the number of answers is specified in a written question, only select or write up to the maximum number of answers. 7. Do not leave without signing out. Should you forget any of the examination procedures, staff members can answer your questions and direct you to the proper station. Good luck!